We have a joint symposium with Henry Ford Hospital in Detroit tomorrow. We're going to be speaking about errors in medicine and errors in management of medicine. So it talks about many things, about confirmation bias, where we try and find data that confirms what we think is happening just to make sure that we look right, versus actually recognize that there are a couple little things in a patient's story that can direct you to the true diagnosis, something like that. There's other errors in terms of knowledge and skill base, things that we try and avoid by having barriers. There's a Swiss cheese model of how to eliminate errors, where you put up multiple barriers so the holes in the Swiss cheese don't line up and lead to an error. So there's multiple barriers to prevent an error from actually reaching a patient. Whether it's our Pyxis machine, which forces you to put in the right medication so that you don't pull out prednisone instead of prednisolone, these sorts of ideas, and so that it doesn't reach all the way to the patient. So the nurse has to check when they get to the patient with their patient ID number, so that's the second check. They ask the patient what medicines they're usually on, so there's the third check, and before they take it, whether there's any allergies, all these different, there's 3 or 4 different barriers to prevent a medicine from actually reaching the patient.